Depending, it's head injuries are no, there is a patient waiting, but that's okay. So afterwards, because head injury is complicated because you have the same side and you have the opposite side of the head injury also. Because you have the side of the impact, and then you could actually have opposite side depending on which way the head went. And so yes, you could be banged here, but actually you could actually have brain damage. And there's more going on in head injury. You have above KB3, for example, is for head injury. It's a bigger subject. So let's start with her, okay? Are you ready? Because we are. Do you have shorts? Yeah. Do you have them?
Yeah, they're on underneath.
Yeah. Excellent. So just come on in and tell us why you're here. But we'll wait for you to come over. Yeah. I'm assuming this says gastro, separately you have an eye infection.
Yeah.
So you have gastric problems.
Yeah, kind of chronic.
What are they?
They're
One of you should tell us.
nausea, and then when I get stressed out, say a week later, I'll just have these attacks and I'll be vomiting.
So it's mostly nausea and vomiting.
Yeah, and they last like about 24 hours, and then they start to resolve.
And you said it starts with if what happens?
Stress.
Stress creates it. Okay.
Stress.
Okay.
Stress. I can't take any stress at all.
Gotcha. All right. And then the chronic back pain is where?
Low back. And
Can you show me where in the low back?
Sacrum.
It looks like, okay.
Low back.
Does it come out here?
I take pain medicine.
So it's hard to, okay.
Yeah.
And the eye infection, how long has that been going on?
That's been going on about 6 months, blinking and stuff. They were lowering my thyroid. And
You have your diagnosis of low thyroid.
But another doctor just upped it, but they put me on, first they said dry eye, and then they said, oh, you have eye infection now. So I'm on doxycycline too, but sensitivity, blinking, a lot.
And how long have you been on the antibiotics?
Just a couple of weeks.
Just a couple of weeks? How long do they want you to be on it?
Oh no, she says take one a day for, she called it rosacea of the eye or something.
Oh yeah, it's a common treatment. Ongoing antibiotic for rosacea.
Okay.
I hate doing it, but
Then you had hospitalized?
yeah.
Okay, psychotic breakdown? Is that what it is? I'm not
Well, psych issues.
sure. Okay. And you still taking Prozac?
No,
that was
none
it.
of, yeah, I'm gonna take none of those.
And what does that say? Age, is that an age or a time? 26?
2000 and 2000.
2000. Okay. And what would it, given
This
Cyrexa?
Cyprexa.
Gained 100. Oh, is that a psychiatric? That's a psychiatric medication?
Yes.
Also? Okay.
Mhm.
And diagnosed with hypothyroid and diabetes. Okay.
In 2007.
Okay. Pain school?
Yeah, I went through pain school, and then that's when they put me on pain medicine.
Oh, if you go to acupuncture school, you get acupuncture medication. Okay, and sudden gastro symptoms appear at age 58. So before that, you never had?
No.
Okay, so there was stress. Okay, so in May, boyfriend left, and you started exercising more and decreased food intake, and then by December, you had the gastro symptoms. So there was all this stress with him leaving, I presume.
Mm-hmm.
Okay, fair enough. This 150 pounds is a gain or a loss?
Loss.
Okay, lost another 100 pounds.
Well, no.
Oh. I don't know. Oh, you were weighing 150 pounds.
Yeah.
Okay, then you lost 100 pounds. That still doesn't make sense.
Well,
Okay, there's a lot of weight loss and gain.
Yeah.
It's basically.
totally, like, it was like 150 or 100 pounds, depending.
You have two teeth pulled, then eye infection develops, ongoing treatment for gastro, chronic pain, constipation from pain meds, and okay. Both parents had thyroid problems. That's interesting. Mother had depression, brother heart problem, father diabetes. Okay, and you have diabetes, okay?
Well, now that I've lost weight, they're kind of, see, it was caused by that drug. So I kind of like a metabolic syndrome. But now that I've lost all the weight and stuff, but because she lowered the diet.
But you're still taking metformin.
Yeah, because my glucose is a little bit higher. It's not perfect yet.
Oh. Okay. And you have problems sleeping too. Okay. So, your main, as everybody kind of has the history, yeah, you had a question?
Do you find the abdomen changes when people come in with the myriad of prescription drugs that they're on? What's
It's
the
good.
effect of?
I can't quite answer that.
Okay.
I'm sorry. But yeah, it definitely, because it affects the body, of course it, but I can't give you like a dogmatic.
Because I do some pulse and I notice like blood pressure medications just blow out a lot of information that I can get and things like that. So I'm just wondering from an abdominal standpoint.
No, you treat what you find in the abdomen. It's like, but yeah, I mean, lots of medications will create, so some of them, you can either create there's nothing or it can create like there's everything. So,
But still treat whatever you find.
Yeah, you have to. Yeah. So it's the nausea, it's the big deal, the eye infection, okay, and the back pain are the three big things.
Right.
By the way, one more thing in the history, she was 3 months in an incubator. She was born, 2 months old. Yeah, go ahead.
Today, well, it's been
You
a
have sciatica
couple weeks.
left
Yeah, really bad, like I'm walking here. Then I almost tripped, so.
Okay. All right, let's put you on the table and see what we can do.
I'm nervous.
I won't do anything to you. Can we take this one off or not?
Oh, okay.
I mean, sometimes you can't, but it would be easier for you to. Sorry? Oh, of course not. Yeah. Pulse is really weak. Sorry, it's hard. It's just hard for me. The pulse is relatively weak, and the thing is, it's rapid. It's actually irregular because now she sort of took a deep breath and it got slow suddenly. So no. Some people, because she's the type of person that everything influences her. She's not someone that she Unlike you, you know, she's not the tough type. You know, she's every change is gonna create a repercussion in the body.
It's the autonomic nervous system there.
Probably. We'll figure out in a second. All right. So I'm going to poke abdomen. Is that okay? It's okay. You relax. You relax. So when I press here, now she has constipation, so I don't think doesn't feel so comfortable, right?
It's not that bad.
Okay. I don't think it's a good baseline, basically. Something here? Some discomfort, whatever? No. How about here?
That's not fun.
That's not fun. Okay. Not fun, right stomach 27. Okay. How about adrenal on the left side?
It's okay.
It's okay. How about adrenal on the right side? Don't think about it, just tell me what you feel.
Yeah, it's worse on that side.
Okay, it's not so happy here. How about Ren 9? And I can feel the pulse.
Yeah, I can feel the pulse too.
You can feel the pulse, all right. How about Ren 12? 15? You don't like 15?
No.
That's clear, okay. How about stomach 21? Because she has, you know, vomiting, nausea in stomach 21. Either side, any problem? No. A little bit here?
A little.
Yeah, this side I can also feel the pulse in stomach 21. Okay. So, okay, we'll finish checking. Actually, no, let me check now. Okay, excuse me. Any discomfort here? I feel a big resistance.
Yeah.
Do you?
Yeah.
Stomach 30. Well, do you feel that?
Yeah.
Yeah, you don't like that?
Mm-mm.
Okay. How about this side?
No.
Even worse. Okay, stomach 30. The reason why stomach 21 on the right side, that may be where things are really coming from. Okay, because the zong qi, the pectoral qi, starts left side around here. Okay, so if that's the case, because the thing is I can feel the pulse, it's pretty rare that you can feel the pulse in stomach 21. I don't feel it in Ren 12, but I do feel it in stomach 21. Okay, and it's a little bit uncomfortable, right? Here?
Mm-hmm.
Okay, so the zong qi really starts at stomach 30 moving up. Interestingly enough, her right side is the one that she was really jumping at. So I'm thinking, I need to now look at, is fixing stomach 30 going to be my first priority or not? I don't know. But it could be where the issues are. Okay, and clearly Ren 15, correct? Yeah, okay, a little below. Okay, how about 17? Nothing. Now, deep 17, no problem. Because I'm trying to check the esophagus because of that. Okay. How about here? Yeah. You correct? You don't like this because I see you jump. Okay. How about pericardium 1? What?
It's
Unhappy?
yeah.
Okay, unhappy. Okay. How about stomach 18?
No.
Under the, whoops, okay. Okay. Oh, both sides, okay. Here and here. Right? You don't like either one.
It's just the diaphragm in this sense.
Could be the diaphragm. I suspect also the liver though. Okay. So, kidney 2. Was that tickle or was that pain?
Kind of pain.
Okay, kind of pain. Okay. How about here? Okay. Okay. So what happens is if she, okay, now I'm making up a theory. I'm not sure about it 100%. Okay. Premature baby. Okay, 2 or 3 months in an incubator. Okay. Therefore, her zong qi, pectoral qi, is not fully developed because the lungs are the last organ that develops in uterus. Okay, so her chest qi is not developed. Therefore, always has weakness in the chest qi. Therefore, she's always going to draw on her adrenals. Her whole life is like basically a little bit of a fight or flight from the moment she was born. Okay? Therefore, as a result, there's going to be this result to be hypersensitive, and I told you, autonomic nervous system and thyroid are going to be highly correlated. Okay? The diabetes, that there is in the family. Both the thyroid, by the way, also is in the family. So all these things kind of draw on each other. Okay? So I don't know if it's from the having been premature. I don't know yet, but you know, it's a theory right now. Can I take your hair up? Are you okay? Your eyes are tearing. Is that from the infection, or just you're nervous?
Nervous.
Okay. Relax. Ooh, have you touched her SCM? It's like this. Okay. 1, 2. It's okay. 3. Okay. Do you feel tight? Okay. Is it painful?
I'm just used to it.
You're just used to it. Okay. We'll see if we can unuse you. Get you unused to it. Hi. 1, 2, 3. This side is a little less tight, right? Do you feel the difference? Okay. How about scalings? 1, 2, 3. Tight? Okay. And 1, 2, 3.
Really tight.
Really tight. Yeah. Right side is much tighter. Yeah. Okay. I'm going for the neck. Relax. Don't. 1. Are you okay? 1, 2, 3. 2. Or.
It's okay.
Okay, this side. 1, 2, 3.
3.
3. Okay. Sciatica. Where do you feel the sciatica?
It's in the left side.
More close to the buttocks? Okay. Is it like radiating pain or something, or there's no numbness involved, is there?
No.
Okay. Don't help me. Don't help me. Is that the area?
Yeah.
Is it painful when I press? Producing something? Is it radiating down the leg? Is it?
Right now it's not painful, but like when I walk, you know, or bend, or, you know, it actually feels like a muscle thing.
Okay. Is the muscle, are we talking about the hamstring? Are we talking about the buttocks? That's what I'm in between.
Like the,
Okay, like here.
yeah.
Okay. When I press, is that painful? Is that producing some discomfort?
Right now, no.
Right now, no. Okay. How about if I press this? Or relax a little, if you can. You don't like this?
No.
Okay. Is that similar to the sciatica, or is that totally different?
Yeah,
It's similar to the sciatica. Okay. Can someone hand me the tape so I can mark the spot, because I may not be able to find it, because I need to make sure it's the exact spot. So it's not on the GB line, it's not on the UB line, it's sort of in between, and it's sort of just under the buttock. So it's here, right? I'm producing?
yeah.
Okay. Just want to make sure I can affect it. So I
Avi,
need
can I
to.
ask a question?
Yes.
Would you consider sinking posture something to look at at this point? in
Yeah.
treatment?
She had right line. Didn't she have right line class?
Yeah.
Yeah, curating
But
space.
because of red line.
Yeah. But hold on. But I always have something more interesting to make things more fun. You know? Plus we have to check the thyroid. Okay. So, any pain here? The main thing I need to do, I need to release this pipe. I need to make, from Cardassian, she has to turn into a Klingon. Okay, because Cardassian has these pipes. The Klingons just have punching bags. So better she becomes a Klingon than be Cardassian. No, if can they feel, or are you too nervous?
It's okay.
It's okay. Come and feel this. Do you feel how tight it is?
Oh yeah, on the right side, much more so.
Yeah. But even the left, I mean, you know, it's like that's you. Most people are not going to have SCMs like this. You know. Okay, 2 more, because we don't want to make too much.
So the, Avi, the tenderness.
Just feel. Don't take too much. No. Don't make too much of it. What?
The tenderness in the K2, would that be reflect the adrenal?
Yes. She, you know,
Thank you.
it's the 5 point of the kidney. Yes.
So you also have the autonomic symptoms,
Autonomic
which are driving the
SCM.
adrenals?
Yes, they're driving each other, and I'm not sure who started, but the reason why I'm resisting everything up right this second is because I want to check my capacity to affect stomach 30, Qi Chang, to get the Qi surging forward, to get the pectoral Qi. I want to see what effect that's going to have on the rest of her.
But then we need to open the neck because if you get all that energy up in the chest, and this is all tight and it's coming to out.
Can you allow me to have my own little fantasies? In other words, we're each going to have a theory of what's going to be most important. I told you, I think it's very important to release this. Yes, I'm not disputing. I said it also. But in my little world, I am right now fascinated by there's a reason why I'm doing this. If I'm looking for the original injury should theoretically be, besides anything inherited, should be there was a birth trauma, she was born premature, and therefore, now I'm saying, because I found this pulse here, I'm saying, therefore, pectoral Qi is not strong enough, the chest wasn't developed correctly, that's going to mean my stomach 30, I'm going to try and see what I can do by if I release stomach 30, will I get a domino effect? That's my fantasy. Okay, you can have the fantasy of the SCM, but since I've been down the SCM route many times and I'll have millions more patients with SCM. I'm not going to have lots more patients with stomach 30 premature. Much more interesting for me, that's all. Yes. Doesn't mean yours is wrong at all.
When you start thinking autonomic nervous system, and obviously adrenals and thyroid are going to be interconnected with that, do you see in your practice that you're always doing those 3? But if you see 1, you're seeing 3, is what I'm asking.
Well, not quite as dogmatic as that, not quite as clear. If you see 1, you'll see all 3. If you see 1, consider all 3. Remember I told you, immune, adrenal, autonomic nervous system, thyroid are all related. One can lead to the other 3, and it's not like Shanhan-Lun progression is clear. From immune to adrenal, from adrenal to autonomic nervous, from autonomic nervous to thyroid. It can start in any one of those and move towards any one of them. It can involve 2, 3, or 4. But it is a cascade. Okay? But my name is not Zhangjong Avi, so I don't I can't tell you the progression. Do you understand what I'm saying? But yes, you're absolutely right. If you see 1, you have a chance of seeing all 4.
Not theorizing birth traumas and things as, autonomic nervous system maybe initially being the catalyst for everything else. So I don't know, I'm just starting to...
Yeah, I don't know. But that's why, but again, I'm totally open to all fantasies in all your little world.
That's what I'm creating.
And I'm totally for it. I'm totally for each person creating their own fantasy, whatever you want to call it. All right, so just to review what we found. You had here uncomfortable. You had here uncomfortable. Correct? You had here. I'm not sure anymore, right? Okay, it's okay. But you have here you hate, here you hate. Okay, and here you hate. Okay, and then the SCM. Okay. Let me just try something.
Can you though explain what the stomach 30 means to you at this point?
It's, I'm not acting like Kiiko, it's terrible. I told you there's a point with a patient where you're trying to get something going and you can't handle all the input, and it just starts to deteriorate. So, yeah. Stomach 30 is where the chest, the zongqi starts from. It's the chang also. Okay, it's her blueprint. Her blueprint is interrupted. The chang is your blueprint. Okay, stomach 30 is also where so number 1 it's the chang, number 2 it's the chest, pectoral qi, the zong qi. Okay, she shows zong qi in my opinion through the stomach 21. Okay, does that make sense? Yes. So I'm just wanting to see what I can do if I could affect stomach 30 and how far will it take me. Okay, so let me just try and then, because otherwise we're talking a lot of theory that may not mean anything, okay? So I have a beautiful fantasy, and if it doesn't translate, it's useless. Okay, I told you, imagination and show me in the body. Then you're useful. Okay, here, right? But more here? Yes. Okay, hold on one second. How's now here?
Not as bad.
Can you speak percentages, if at all possible? 20% better, 50% better, 80% better?
70?
Okay, hold on. And now?
Probably like 85.
Okay, fine. You had here, how's now?
Like 85.
85 better? Not 85 left, okay. You hated this guy, you hated this guy, you hated this guy. How much do you hate them now?
Not that much.
Would you take them as a boyfriend?
Not really.
Okay. All right. Spleen 4, Chong. I'm starting with a Chong.
Yeah.
I'm allowed to be simplistic too. I mean, look, if you really want me to get complicated, I'm not even going to touch spleen 4 and go to stomach. You have stomach 42 as a chunk point, you have liver 3 as a chunk point. I mean, I have lots of options. I mean, it's not like, I can get weird around these things. Okay, so now I'm not touching spleen 4. 1, 2, and 3, tight, right? Okay, I'm curious. 1, 2, and 3. Is it better or not?
It's better.
By how much?
30%.
30% only. Okay, that's fair. Okay. Let's do what we just did before. And then continue. Why? Because when someone is so, I'm sorry about this because it's kind of sucks because if you don't have course, it's not.
Well, could you do this with needles, the infinity treatment?
I need the infinity, for the infinity part I need this, but okay, you'd rather I didn't? I'm happy not to do it. It's okay, because it's too much.
No, do it.
No, because already someone.
And whatever's best for the patient. But I was just curious if we could do it, like if by needling.
No, just the needles. It's really the transfer of the ions. We even have the cords available. It's kind of cute. Nobody can say that this is wrong. Unclean cord technique.
Okay, next question. Could we use our e-stim machines?
E-stim? Because the cords are available. You can conceivably do something else just to get this cord. Actually, you can put this on needles. There are people who do this on needles, and then you don't need the pachi. Well, you still need the pachi, actually.
Really?
Yeah.
I guess what I'm saying is, could I use my e-stim machine at a very low setting and attach? Well, no, because you can't do cross. Never mind. You can't cross the limbs. So. I was trying to figure out how to do it with those cords.
For cardiac, you can't cross.
Oh.
You can, but I don't know. I can't answer you. But let's see. I'm not even sure this is going to work. This is just a game. Sorry. And Okay. How are we doing here? It's okay? Oh, no, okay. This may not have been quite right. I mean, I just translated into something else that was convenient. But how, this one? Your non-boyfriend. Is he okay?
Yeah.
Okay. How is this non-boyfriend?
All right.
Okay. The one on the left, non-boyfriend.
Okay.
All right. And how's this guy?
Okay.
Okay. So, okay. Now, how is the boom, boom, boom?
Better.
30%?
Yeah. Yeah.
Okay, no, that's fine. So the interesting thing is that this guy is still pretty sucky.
Yeah.
Okay.
It was better with just the palpation on swing 4, right?
Yeah, well, there could be all sorts of problems. First, yeah, so this is not the best strategy. It's okay. No needles, no problem. I still have lots of options to add. Okay. So, here, right? Am I on the right spot? Do you dislike me pressing here?
Yeah.
Okay. Because Sea of Charm. Okay, I'm just trying to see how much can you milk out of one idea. Basically, that's really what this is about. Hi. And notice I'm totally on the other side. How are you doing? How's this? This guy here.
Okay.
It's good?
Yeah, it's better.
How much is left?
Probably like 40.
40, okay. And now,
Better. Yeah.
how much is left?
It's probably like 60% better.
Okay, 40% left. Okay. Now, is this still painful? The sciatica?
It seems better.
Okay, and when I press, how's now?
It seems better.
Even better when I press?
Yeah.
How much is left on the sciatica?
Probably like 40 maybe.
40, okay. Okay, we'll see. Okay.
What about the edema?
Well, that just means that I really need to do it. Yeah, it's often, stomach chi that's so pronounced, you definitely want to look into. So I'm holding the needle so it doesn't move so I can find the next bump. And she actually doesn't have, so I'll go for 41 because chances are, okay, here, right? Hi. Pain here, right?
Yeah.
Okay, I want to know if the pain is better now.
Yeah.
How much is left now on the thigh?
Maybe 20.
Okay. So stomach 41 is part of stomach chi. Are you okay?
Yeah.
You sure? Sorry. Oh. Relax the leg. I know it's hard. Are you okay? Are you okay?
Uh-huh.
You sure? Okay. All right. That's one of the advantages of this is less needles. Because the patient that jumps with every needle obviously wants less. Okay. So, are you okay? Don't. Still not happy? Was that a aha? Or, I mean, I'm not sure. The communication is not so great.
Yeah, not happy.
Not happy. How much is left here?
No, a lot.
Not a lot?
A lot.
Oh, yes, a lot. Okay. So it got worse, in other words.
Yeah.
Okay. All right. Can we go on? Is it okay to continue? Or?
Mhm.
Okay. So, here, right? Okay. When I push on the outside, how is this guy here now?
A little better.
How much is a little?
Like 20% maybe.
20% better or 20% left? 20% better. Okay, not a huge amount. Okay. How's now?
A lot better.
A lot better. Okay. So we'll do both. I mean, because it's the continuation. So basically, again, coordinating the three dantians. Okay. So now, with a patient of this type, sometimes you think you're on the right idea, and it will switch on you. You think everything is cool, and then it turns out, well, actually it isn't. So, well, we're just going to have to sit with that and work through that stage of, because you know, there's no choice. You know, you have to do the things that you think are going to work, and just accept that actually they don't work.
So
Curious
are
what
you,
the tattoo is.
can I ask?
Yes.
So are you saying that even though Mushu didn't produce a
But you
dramatic
did.
effect,
It did 20%, but UB2 did a dramatic effect.
right, you would still do both because you,
Because I'm still
your
interested in the whole
experience.
thing. Now, because for me, they're good friends for one thing. And also, this I can say maybe has to do with the eyes, which means it has to do with perception of pain.
Right.
I mean, but if I just do UB2, I may not be quite on the best track.
And she has like problems, is that part
Yes,
of it?
that could be part of it. No, but it wasn't. I knew that would come up. That, you know, but UB2 is definitely one of the points we use for eyes. Hold on one second.
Mhm.
But for her, I'm going to actually, for the eye, I'll probably do something else.
Mhm.
Okay. Is that okay? So it's interesting that some things that you think would be really sensitive are not. And some, you know, other places. It's just how it is for you. It's okay. So remember, Mushu and UB2 for me is creating the space of the three dantians and allowing the three diaphragms to, you know, to coordinate. All right, so how are we doing here?
Okay.
You sound like you're not convinced. Or at least you're
Yeah,
not convincing me.
I still feel it.
Okay, how much? So let's do a contract. You tell me percentages of how much is left each time. So from the very beginning, when you were jumping, how much is left here?
Probably like 20.
Okay, 20% is not the end of it. It's not bad. I will get it better, I hope, but you know, at least I know where I stand. Okay. How about this sciatica guy? How much is left from the very beginning?
Maybe like 10.
10% left? Okay.
Uh-huh.
So not bad, okay. You had something here originally. How is he?
It seems to be maybe gone.
Okay, good. The 3 boyfriends we kicked out already. Okay. So, relax the arm. 1, 2, 3, correct?
Uh-huh.
Oh. Sorry. How is now? 2, 3. 3 is better, I think.
Yeah.
But 2 and 1, not so much, right?
No.
Immune.
No, triple warmer 8 to release SCM. But first of all, she has thyroid, and she has kidney 2 pain. Hi. We're talking about number 1 here. How's now?
Better.
By how much? Remember our contract percentages? How much is left?
Maybe like 10%
10%.
left.
Okay, good. All right. So let's do kidney 7 and 10 both sides and triple warmer 8, and let's see then what our story is. Sorry. I should have started on the left side, but. So, well, the thing is, like, yes, I can always go back to the same old. There's nothing wrong with that. But if I want to try something different, I have to look at that first. Because if I solve everything with kidney 710, I miss my opportunity to make up another story. So if I just go, okay, she's thyroid, kidney 710, I can't really do spleen 3 on her because of the bunions. That's why, the diabetes part is not so...
Can you say a little bit more about why you can't do spleen 3 for the bunions?
Would you like to do spleen 3 on her? Would you do... It's a question of like, do you have a space for a needle? Yeah, there's no space here, really.
Is there an indication for you?
Don't.
So many people have bunion.
Yeah, it's a spleen, it's chances are it's a spleen 9. I mean, if they had bunion pain, I do liver 5 and spleen 9.
Right.
That's, by the way, the treatment for gout also.
Right.
But if they don't have pain, I just need, if they don't have pain on the bunion, I still consider it, which would have been spleen 2 pain, supposedly, because it's not exactly spleen 2. I would still consider it as spleen 9, spleen 5, spleen 9, because it's an inflammation in the channel.
Yeah, I found it often with patients of mine who have diabetes that there's bunions. I see the correlation there.
Well, not all diabetics have the bunion sticking out, but
Sugar, people with sugar stuff, I've just noticed.
will have a lot of bunions.
is-
Bunions are fairly common, yeah.
It's not just postural, like initially the channel, something like
Yes.
happening there,
Yeah.
and then
Yeah, that's the assumption. So, height. How much is left? 1, 2, 3.
Probably 5%.
5% only? Okay, not bad. Even on 1, only 5%?
Maybe 10.
Maybe 10, okay. And now,
5.
hold on. And now,
It might be gone.
okay, good. So I just took it further to the small intestine channel. That's all.
When do you actually needle Sangel 16?
Very rarely. If they have REN 12 or REN 17, you could. But I'm not that thrilled about doing that. Okay, and here you have 1, 2, 3, correct? Okay. How's 3 now?
Better.
How much is left?
Sorry.
Maybe 5.
Okay. How's 2?
Maybe 10.
Okay, and 1.
5.
Number 1.
Might be gone.
Okay. Number 2 was 10%. How much is left?
5.
Okay. And 3.
maybe 10 still.
So, can't always do everything.
Why are you doing 8 instead of 5? Because she has a rapid pulse.
First of all, she was fluctuating, and secondly, because I already have something on 5, I don't have an option. I was kicked out of 5 by having done that. So I didn't have an option. Okay. How are you feeling in general?
Okay.
Okay. How's the leg?
It feels good.
Okay. And the stomach, gastritis part?
It's fine.
Okay. We'll leave you alone for a little bit. Is that okay?
Mhm.
Do you want to cover?
I'm all right.
You sure?
Mhm.
And what about Moxa?
No, too sensitive. I don't want, you know, she's the type of person, you know, do you see how she jumped at some point?
Yeah.
Right now, I would say no.
Yeah.
You know, it's always interesting. The people who are, you know, like working in someone else's clinic, always want me to do moxa because that's what they're being asked to do. And someone, you want to do more moxa? It's like, sometimes you just have to accept that this, see, the thing is, it's very easy for, you know, if I'm the big acupuncturist, like, you do moxa, I'm leaving the room. It's like, whatever happens is your fault. It's like, that's way too easy.
Mm-hmm.
Some patients, you just can't, you know, it's like, it might be good for them, but you can't do it. It's not gonna work.
I guess that was kind of my question. Like, do you think it could be good for her to Moxa some of these points if it wasn't so, you know, sensitive?
Yeah, but it's not worth it. It's just not worth the possibility of it backfiring. The moment you put a person on the table in sympathetic mode, you undid whatever you did in the treatment. Why bother?
Yeah.
Because it's good for them? Well, I don't see what's good for them. It's good in theory, but it's not really good for them.
Right. No, I understand.
So I think it's a waste of time for her right now to do moxa. But I have other things I can do. Since you asked, and since we're playing with toys,
I guess I'm just trying to learn which points do I Moxa when is thinking of. But I get it.
slowly, but okay, element on element, and then you have your liver 5s, you have your large intestine 15, you have your T11, T12, spleen 5 would be a moxa point often, anti-inflammatory for lower GI. Immune would be nice to moxa, is an extra moxa option. Okay. So, sorry.
Toys.
Toys.
Never seen these. It's all in the book.
Diagrams. Let's just make sure. Gone? Okay. Boyfriend, and boyfriend. All gone? Okay. Cousin. Gone also?
Almost.
Almost. Okay. That's one option. To check this, there's nothing now. So, cousin and, oh, you still had a little bit here, right?
Mhm.
And how about here? Yes. Or no? You feel?
It's way better.
Okay. How are your eyes, by the way?
Well, they're not blinking. and
They're not
stuff.
blinking. Would they normally be blinking at this point?
I think so, yeah.
Okay. Okay. So I'm doing pericardial finger and large intestine finger. Large intestine finger I'm doing because there's an infection in the eye. And we'll see what the effect is.
Large intestine for the eye is because it goes close.
No, because we have large intestine too is good for infections in eyes. And since I was not, you can let go of the fingers. Okay. How is now? 2, 3.
Better,
Better? And right side, 2, 3.
better.
Okay. And your cousin. There's all sorts of cousins, you know. There's close cousins, distant cousins, you know. You can.
I think he's out the door.
He's out the door. Excellent. All right.
Yeah.
All right. We'll move away so she can get some time on her own. Okay. All right. So the rings, they have a diode on them. So this was totally not meant to be a toy class. With patients like this, that are really sensitive and they can flip, you know, like everything can flip and then they can go like, I want to go say they can go berserk, but they really, the whole nervous system can just like, in one moment, can just like collapse on them. Okay, they can, you know, and we all see that, you know, suddenly a patient that just totally, you know, they start crying or they have some sort of emotional upset or whatever because their nervous system just can't hold it. The toys are really good because needles are difficult, you know. You know, they jump, whatever, you know, it's like, you be too, no problem. Stomach Chi, you know, she jumps, you know, it's like most people, like, Stomach Chi can be a little sensitive, but most people are afraid here, you know. So, in that sense, the toys now, the rings, I'll show you that there's a direction to the rings. So it should go towards large intestine 4, and I'll explain to you what it, well, unless you have rings, actually, it kind of really doesn't matter. Who here has rings or hasn't? Okay, all right. So, which case, I will explain. Oops. All right, okay. So, they come perfect colors in green and in red. And originally when you get them new, the diode itself, half the diode will be color and half of it will be white. But because that will fade, see in a second if I can get one. What they did was, the red, I think the green ones have an extra flat part here, and it's painted. Oh, oops, no, it won't be here. It will be on the other side. And the red ones will have like a circle here. So this is more flat, and this is a circle. And some of them have two I mean, the thing is for blind acu, because it's also painted, extra red will be here. I'll show you in a moment on the ring. So, and then they have, because there are people who are blind, they have like one slat here or two slats here. Basically, so you can tell the direction. The direction is towards the colors. So this diode, its direction goes this way. This diode, its direction goes this way. Okay, so the diode has a direction. On the 5 fingers, when you put a ring on any of the fingers, the direction has to go towards large intestine 4. Okay, it has to go this way. If you put it on the thumb, I'm just using a different color for the sake of it, the thumb has to go towards large intestine 4 also. Okay? So this ring right now would fit perfectly over the thumb. But the way this ring is right now, it cannot go on the index, middle ring, or little finger. I'll have to turn it over. This ring can go on any one of those. If I want to put it on a thumb, I have to flip it around. Okay? So when you place the diode itself, the diode can be anywhere on the finger, but if you're when you place it, I place so that the diode is on the young side, and I make sure that the direction goes towards large intestine 4. Okay? And the indications for the fingers are just basically, this is lung finger for lung problems, digestion she has, and skin, she has scleroderma, blood pressure, autonomic nervous system, etc., cardiac possibly also, autoimmune disorders and autonomic nervous system is 3rd, and the little one is cardiac and back pain and gynecology, cardiac on the left. Which color you use does not matter, except, these are your rules. If you're using the same thing, you can only use 2 rings per hand. Okay? If you're using on the same hand, can't use same color. Two per hand must be red and green. Okay? The opposite hand, if it gets, you can have 2 red and green. Same finger, opposite side, if this is red, this must be green. Well, it doesn't must be, but better. Okay? Then, the places where it's going to matter is this thumb, the right thumb, is also liver thumb. So that's, if you have liver excess, this should be green. If you have liver deficiency, right thumb is red. Okay? Yeah, well, it's a bunch of rules. Cardiac, the only other finger that matters. So in other words, if they have a lung and a liver issue, are they liver? So I'm going to do this. The question is, where does the red go? Where does the green go? If they have liver excess, right side gets the green, left side gets the red. If they have liver deficiency, right side gets the red, left side gets the green. That's all. Okay? Now, if they have a cardiac issue, left side little finger can only be red, never green. Okay? So you just start with, am I doing liver or heart? And calculate the colors accordingly. In her case, I didn't use either, so it didn't matter. Fair enough?
Is green reducing red?
Supposedly, yeah. So for example, you see Kawai, if you have numbness in an area, he'll rub a red diode ring against the numbness, and it gets better. Okay, whereas for pain, we tend to use green more. Okay? So there's lots and lots of usage for the diode rings. I mean, they're really they're quite handy. They're quite useful in my opinion. But unfortunately, it's something that went out of style, and so they're hard to get, blah, blah, blah. Now, Kawai, I think he's still alive, but I don't think he produces diodes. And so David still has diodes that he got from Kawai, and everything else is like, it's hard to know, are they the right diodes or not? I mean, it's something that needs to be clarified, how to get them now. So that's why it's sort of gone out of style. Okay. So this character we'll look at afterwards. Okay. Any questions? I'm just going to move there so you have space. Yes.
You're seeing a patient and they've got a lot of reflexes, and you're releasing some reflexes. At what point do you say, I can't release some? If some of them aren't releasing, at what point do you say, I have to just leave her as a treatment and move on and not do that anymore in a session? Or do you ever get to that?
No, of course you get that. I'm saying that there's always going to be patients that you can't fix everything. You try and delay that decision as much as you can, basically. So don't get upset if the first attempt didn't work. So if after the 5th attempt of a strategy, that is, it's totally not working, yeah, give up. I'm not. I've once seen Kiiko. There was a woman came, it was something in her feet, I don't remember what it was. And Kiiko kept her for like 4 hours in the clinic.
You get it?
That's not the point. The point is she was trying to get it.
Right.
Okay? So you really, that's what you're trying to do. You really, so I always, the thing is, it's also a question of rooms. So Kiiko tends to work with many rooms, and I do too, although I don't, right now I'm really only working with 2 rooms, but I used to work with, at one point I had 5 rooms.
How would that work? If you haven't released all the reflexes, you just leave them with the needles for a while and come back?
Yeah, but damn it, my ankle isn't better. It's like, you think you did everything right, and then you come back and they say, no, but my ankle isn't good. Kiiko's very insistent. She wants to solve the problem. Because otherwise she looks bad. The person won't refer, whatever it is. It's like, so it's, it's up to your personality at what point you get in. So not everybody, you also have to do the calculation. Say you're working with X amount of rooms, with X amount of patients coming. Okay? this patient needs to move on because otherwise the next patient doesn't have a room.
You don't get to a point where like, oh, this person has 3 roots, so I got 2 of them, but one's just not, this person's too
That is not a good thing to do.
ill right now.
I may have to do that, but it's a very bad thing to do because the one root that you left, that's why I always do front and back. One of the biggest mistakes that people make is they don't treat the back. They think you can get away with the front only. And often, once they start doing the back, the patient starts doing it because what happens, you don't know what you left in there. The tiniest thing that you left can become the biggest root there is. You know, it's like weeds. If you don't pull them out, they'll grow. And you don't know which weed can become like a huge problem, you know, and how many seeds it has. So of course, sometimes you don't have a choice because you couldn't. But in an ideal situation, you treat all the roots. You don't say, okay, these 2 roots, I'll take care of the 3rd one tomorrow. Because when tomorrow comes, that 3rd root, now, with the other 2, supposedly the other 2 have been tapped into, that 3rd root now has become 5 roots. You just have no clue what it's going to do. So better,
It's great analogy.
so you really need to, as much as you can, treat all the roots that you can find, because as it is, you're working half blind. Not you, we. Okay? No, in other words, when you say I have 3 roots, assume there may be 10. You'll see 3. So each one that you don't deal with is, what are we doing out there?
Coming for you.
And how frequently do you see patients?
Sorry?
Do you have a frequency regimen? Do you see people once a week, once a month, twice a week?
My preference is once a week for the first 4 weeks. And then partially because otherwise I forget. The ones who come, they want to come once a month, and there are people like that sometimes because they think they should be on a maintenance schedule, sometimes because they can't afford it or whatever. Those are the most annoying ones for me because they come the next month, I have no clue who they are. How could you remember someone a month later? It just doesn't make sense. The next week you can remember. So my preference for patients, the first, now of course they come for low back pain and the back pain is gone after the first treatment. You try and convince them to come the second time, because they'd be good, it'll be maintenance. And you really don't know if the back pain will stay away. Only after the second treatment when they really say, listen, my back's good for the whole week, I don't need to come back. Fine, no problem. But I try and book them again the following week, partially so that I can see what the hell's going on. Because my real evaluation is in the second treatment, not the first. The first treatment is when I'm trying to create a strategy. But when a patient asks how many treatments, I tell them wait until next week because I can't. I won't know until you report back how effective this was.
You are ongoing patients in, like for years of coming in for,
Not that many. I have patients who I've seen, like a long time ago and they come back. My average patient, I would say, is 4 to 6 visits. That's the average. And there are some patients that I see long time. Long time I consider 6 to 9 months. I have some patients who I will see over years, but very, very rare will someone come for more than a year on a regular basis, no matter what they have, because they're done. They just, even if it's helping, say the cancer types, the blah, blah, it's like they can't do treatments all the time. They also need to take breaks to begin with, in my opinion. So, now I realize that because I know fertility is a big subject, it's a good way to get patients, and you can see people for 3 years on a weekly basis. But I personally am not so sure that it serves the patient so well. But I don't know. But yeah, I don't have people that I've seen for years continuously, constantly. I've had people that I've seen for years, but on and off.
And you mainly see patients with symptoms. Your patients always have symptoms.
No. The fact that they come means they have some symptoms, but I know what you mean, like that I have all sorts. I am not, by personality, inclined to be a good person for the people who come for maintenance, or I'm a stressed out, I'm a busy lawyer and I just need, it's like, go get a massage, would be my take on that kind of patient. They're not going to feel comfortable with me. Anyone else?
How long are your treatments?
Supposedly an hour and 10 minutes. But it's not always, it can be shorter, because I do both sides, etc. It can be a lot shorter. I can get someone up in and out of the door in 45 and still do everything. But that means basically not talking to them at all and like really, just going through the whole thing as fast as possible. Because if you think about it, it's 5 minutes to diagnose, and I'm not a first-time patient, but you already have a clue. It's basically 5 minutes to get the needles in, 20 minutes for them to be with the needles on the front, that's 25 minutes. 5 minutes to turn them over and put needles in the back, maybe a few more minutes, you're at 30 minutes. 10 to 15 minutes on the back, give me 5 minutes to get the hell out of there. You can finish in 45 to 50 minutes, it's totally possible to do 2 side treatments. Is it convenient? No. And then the problem is how many other people do you have? This is if you're really available to come in and out of the room at the right time. So I don't always have that luxury, so I will sometimes leave people longer because something else is happening in another room. Okay, so, and also, I do talk to people. Now, one of the things is you asked me, I think it was you who asked me how, for beginners, how to. One of the things that I suggest in integrating is talk to patients less. One of the things that people complain a lot about is I can't talk to people and then get them on the table and cooperate. That's a specialty, okay? It's a lot easier to get a person right away on the table and just talk and treat at the same time. You'll find that it's easier. You also don't need your 10 questions. You don't care if they're sweating or if they have bowels or they have whatever. It's like, you already know what they have from the piece of paper they filled in. Okay? That's how Kiiko works primarily. Very, very few questions. Okay? Since I do talk to people, that's what I mean, it's a specialty. I have a lot more experience in being able to get them on the table and still move them. Because if you do this thing that's like, and yeah, your cousin, and you're upset with your mother, and blah, 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 and you check the pulse, and it has a certain sort of coffee shop mentality, atmosphere, which may be very nice for the patient, granted, but then you get them on the table and you need to get them moving, they're not going to say a word to you. They just these are the patients that want to go, once they're on the table, they want to go to sleep, right? Yeah. So to get them to cooperate, you need to keep them a little bit more alive and less relaxed. So most of you at the beginning are not going to be able to do that, get the feedback you need if you do a lot of talking up front. Okay? So I can do that because I have a lot more experience in this. So it's not fair for me to say, yes, you can do it. What I hear from other people is no, that they can't. So I would start getting people on the table a little bit faster if you want to do this style, kind of more comprehensive. And then start playing and see what suits your personality.
If you notice people start autonomic sweating, like sweating in their hands and feet,
yeah.
Do you do a fire right here?
Yeah, under the third toe. It's a sympathetic dominance. Or you could do behind the ear under the tendon. We call Kawai's ear point for thyroid. Yeah, you have to, you better and better address that. Yeah, and if it's the only time when it's not, be careful because it could be a diabetic reaction also. In which case, I would actually suggest take all the needles out for a little bit because needles generally lower blood sugar. No matter what you do with needles, they'll lower the blood sugar. And if somebody's going into diabetic shock and they're starting to sweat, you want to stop that process no matter what. Or give them some, put some syrup in their mouth. But if you suspect that sweating is, if there's a possibility that it's a glucose shock, that they're dropping sugar levels, I would not continue. If it's a nervousness, yeah, of course you have to stop. I mean, and address it. But if it's a glucose thing, in my opinion, the only way to really address it is to first take out the needles. Because as long as you have needles in, you're lowering the blood sugar. And it's not right now. It might be what you want to do long term, but it's not what you want to do right then.
What angle do needles hinge off 5?
Towards small intestine channel.
So what would you do for somebody that has like night sweats or day sweats? Would you treat like you would go into like
Deficiency or non deficiency?
I know.
Well, the day sweats are different than the night sweats. Depending on what the issue is.
Thyroid is like your hormone.
Okay, well, it depends. I mean, are you talking, for example, is it menopausal women? Is it who and what is it? What kind of, it's like just sweating is just one symptom from, in their array of things. So yes, sweating could be a sympathetic dominance situation. Yes, it could be, but it may not be. I need to find out what else is going on. Why are they sweating? Are they sweating because they have, do they have a urinary blockage, for example? Is there a kidney filtration problem? Maybe that's why they're sweating, because they can't get rid of stuff in the blood through the kidneys. Therefore, they're sweating instead. I mean, I'm not saying it's common, but it's certainly an option, right? So I can't say sweating is that, but if sweating is an autonomic nervous system disorder, then yes, I will treat the autonomic nervous system. If it's menopausal from hot flashes, then menopausal is adrenal treatment, plus spleen 9, plus gallbladder 34, plus gallbladder 27, 28 towards the thigh, towards the leg.
What about nose sweating?
Nosebleeds?
No sweating. Not sweating at all. They
no
people that can't
sweating.
sweat. Like what would you think of for that?
I don't know that anyone's ever complained about not sweating to me. I mean, so I don't know that I can give, I don't have a good recollection of someone with that or the idea. So don't have no answer for that one.
Do you tell people to eat before acupuncture or right after acupuncture? What's your preference? What do you see?
I don't tell them anything, quite honestly. I think on my website I put one of those things, don't have a lunch meal before, I don't know, whatever. And I palpate abdomen, obviously I don't want them coming after they had a huge meal.
Yeah.
I don't consider it that important, quite honestly.
Just because of the blood sugar, obstructing.
Well, I don't want them coming in without having eaten a whole day,
Right.
but then I have, every so often I get people come from Boston or further, people coming from like 2 hours away. I mean, remember, I'm not in San Francisco, I'm in a rural environment. I don't know when they, it's like, it's a little bit, different. But no, it's not a big concern, it's not in my consciousness. So, what is in my consciousness, yes, I did have somebody go through diabetic shock on my table, and that was really unpleasant, especially when they started peeing on the table. It happens in diabetic. What happens in diabetic shock? Everything gets lost, sort of thing. So that's why I'm very cautious of that. But what time is it? I just want to make sure we turn over. 11:55. Let's turn her over and do the other side. How are you doing? been holding your hip. Is that because there's some pain? On this side? No? Just checking.
What time are we going to lunch today?
In about 15 minutes?
Oh, yeah.
But I don't think they're
Thank you very much. Now you have your bracelets over here, just so you know, so you can roll all parts of them. All right. Let's. Oh, you want to back one? Okay. You can take one or not. Hold on, you have a little. Okay, let's flip you over.
And your face can go through the hole here.
Is that okay on your back this way, or would you prefer to be on your side? Shh. Sorry?
Okay.
You okay? All right. Do you want your arms here, or can you put them to your side? Is that okay? Not comfortable, or?
Yeah, okay.
Oh, you do want this arm up. It's okay, you can have it off if you want, I'm just asking.
Do you want me to move your bracelet for you? Okay. Thank you.
Ah, that's what. Thank you. So of course she has to have to do 11T12 because of diabetes, but we have to check everything else too. Hi, 1, 2, 3. Anything, Laura? 1, 2, 3. 2. Okay. And on the back, anything T4, T5 because of eyes. Yes? No?
Maybe the middle one.
This one.
Yeah.
Okay. So this one and this one. Okay. How about 1, 2, 3, 4? Also stomach is T5. Anything?
No.
1, 2, 3, 4. Nothing. So this one a little bit, and this one, correct? Okay. And anything? No? Okay. All right. So UB52 we're going to do, because it's continuation of Ren-9 pulse. We'll do 2. She's hypothyroid, so we'll do the hypothyroid treatment. So we'll confirm do 2 with. Here, right? Is the shoulder better now? Sorry?
Can you say that again?
Yeah, okay. There is discomfort here, correct?
Yeah.
Okay, when I press on your buttocks, how is discomfort on the shoulder?
It's kind of the same.
The same, okay, thank you. Let's try a little bit lower. Now,
It's still.
okay,
there.
fair enough. And one more.
It's still.
No
there.
change. Okay, fine, no problem. Now, still?
Yeah.
Okay, okay, hold on. And you had something here, correct? So this
Yeah.
is refusing to move, basically. Okay, so how's this one now?
Better.
Better, okay.
It's right in the sacrum, right in the beginning.
It's could be lower, yeah. I mean, I told you, I take do to a little bit higher than what you would think. Okay, this one's not affected, right? It's still there, right?
Yeah.
Okay. How's now?
Better.
By how much?
40.
40% better? Okay, hold on. And now? Sorry?
Like 60.
60% better. Okay. So UB52, continue adrenal, so... I know they're not in the same level. So better too. How much is left here?
Probably like 20.
20, okay. And now?
Still 20.
Still 20, okay. Now?
Still.
Okay, hold on, one more, just in case. Now.
Oh, okay. 10.
All right, fair enough. So T11, T12, and then T7 and T5. And then we'll see where we're at. Did you say 10% left? Okay. And now? Sorry?
It might be gone.
Might be gone, okay. We'll hope that it is. Hold on. Are you okay?
Yeah.
Sorry. Small intestine 910 is also part of the autonomic nervous system treatment, right? So, anything left here?
No.
Nothing?
No.
Okay. Also, UB43 area, meaning congenital stuff, because of the lung. So that's why I'm so interested in it, besides the autonomic nervous system. So, small intestine 10 and 9 in between, and needle. Now, if you wanted to really needle into the delta, you'd have to be on the edge. You know, so but I don't find that this is good for shoulder, but if you really want to get the sympathetic nervous system, you're better off coming down a little bit. There's a place that when you push on it, it feels mushy in there. Like there's like an extra cushion. That's what I'm looking for. Okay. So, and we'll just do moxa on her because she has insomnia. So insomnia point is between yin chow and yang chow, middle of the heel. So, So some places to practice Moxon, that would be a perfect place to practice Moxon, because most people are not going to have an issue there. You know, it doesn't feel so strong. And the likelihood of you being able to burn someone here is very, you know, like immune point you can create, you know, a burn. But here it's very unlikely. Let me know if you feel anything besides my fingers touching your heels, okay? So you might feel like a little mosquito bite, you might feel warmth. Just let me know. Okay, so this one's huge, I have to watch out. Nothing, just my fingers up to now? No warmth? Sorry?
Yes.
Yes, just my fingers. Okay.
You put in burn cream underneath?
Yeah, in this case it's really more just to hold the first few. Because I don't need a lot of burn cream here, because they usually don't feel it so strongly, and because the skin here is so much thicker. So that's why I'm going for larger cones also.
You can use just a little water.
If you like, I don't know, I've never used water. So I use the burn cream. And I don't like the Chinese burn creams because they spread and then they melt on your finger and then you have muck on your fingers and you need to keep your fingers clean. So I like this, the Shionko. So this is one of those situations where nothing's happening, I'll probably give up. Because she's not feeling any of them. So that's okay, you know, it's not the end of the world. I mean, because I can go on and do this for the next 20 minutes and she may still not feel anything.
But your goal is to have some response?
Yeah, ideally they should feel.
So once they have a response, then you're done?
No, then you want them to feel a few. You want them to get a few more. We say they should feel, 6 to 8, something like that. Some places they should feel 21 times.
21.
Yeah, liver 5 is one of them. Is a 21 ouchies. Large intestine 15 is a 21 ouchies.
Liver 8.
No, that's 8, 7 or 8 is good enough. You can do more if you want. But
Okay, I felt that one.
good. Finally, she's feeling something.
So then you pinched it out. Yeah.
I did. I don't know. Well, maybe I was worried that it will really burn, because once you start feeling, some people, once they start feeling, they really feel. You can't put them on while the other one is burning.
Yeah, I'm feeling both twice now.
Okay, good. Sorry. Good. Gone.
Yeah,
All
I
right.
feel
Okay, done, no more. Is that okay?
okay.
All right.
So, I mean, just after this treatment, do you think she might just sleep? Or how many treatments?
No, I don't expect, well, I don't know. Some people respond right away to this, some people don't. You know, it's a very, you know, you do it, you know, something, how long will it, but no, do I expect it like, everybody falls asleep during the treatment.
Well, yes, the treatment, sure, but
So after the meeting, will she sleep better tonight? I don't know. I can't guarantee it because, you know, I just don't know what will happen.
Where do you get that syringe?
Any pharmacy, they'll give it to you for free. They'll give you 2 or 3 of them for free.
I'm like, how, what?
one thing.
Yeah.
Don't suck it in. These are oral syringes.
Oral
These are not, you know, yeah, you're asking, and most pharmacies, you can buy oral syringes, but they cost like $3-4. Why waste the money? If you go, you go to the pharmacy themselves, you know, and ask them if they usually will have, and they'll just give you 2 or 3, you know. And then when you fill the cream in, I know this sounds stupid, but people are trying to do it. They say, how do you get the shionko in there? You can't suck it in. You have to put it, you have to take the plunger out, put the shionko in, and then you put the plunger in. Okay, because people try and suck it up, and it's like, no, that's not going to work. It's not liquid. No, with liquid it works, but it's not liquidy enough. All right. Let's have you sit up and tell us how things are.
Did you put a press pack in there? On the side? Is there just...
Unless
No,
it's
no,
too-
it was a marker to see where the sciatica thing was. Sorry. How are you doing?
I feel good.
Go walk around and tell us how the sciatica is.
Okay.
Take your time.
Feels gone.
Go ahead, go all the way there and back. It's not that long.
It feels gone.
Good. All right. How's the? I know you don't feel like vomiting all the time, but how does the gastric stuff feel right now?
That feels okay. You know, it's mostly in the morning,
Mm-hmm. Oh,
like
okay.
when I wake up,
All right.
is when it starts, and then like if I'm gonna have an episode, I feel like I have to eat.
Mhm.
So I eat, and then like 2 hours later, I start vomiting. And then it just goes for
Do you
like,
eat without drinking first?
no, but it just feels, you know, like feels like if I eat, it'll be better, and I should.
No, I understand. So you get up in the morning and it feels a little bit queasy. So you feel like you should eat something. And then 2 hours later, you feel like throwing up. My question was, when you're about to eat, you feel queasy, so you want to eat. Do you drink something first? Do you drink water, hot water, you know, before?
Well, not really. I mean, I'm on herbs, so I do
You drink
those
the herbs first.
every morning. Yeah,
Chinese herbs?
yeah.
It's kind of interesting. Chinese herbs can really make you want to throw up.
No, I mean,
Maybe take the Chinese herbs separate. Don't take. Why do you have to do? Do you need to take them in the morning?
Well, usually like her symptoms are in the morning, and you know she
But it
feels.
sounds like it may. Well, okay.
Because see what happens is ordinarily she doesn't have any symptoms, until there's a stressful event. So we're just, trying to keep her.
What are you giving?
Basically, it was modification, shell check and tongue, but now it's more towards, check and tongue and, not so much shell check and tongue at this point.
Not so much shell,
So it's basically the
I know
base course.
shell and I know da, but I don't know what the chai hu without either shell or da.
Oh, it's shell. Well, no, I mean chai hu, it's more chai hu tongue right now.
What's
So,
chai?
Cindy's son family.
Okay.
Yeah.
Bai shao jika chai.
Yes.
Okay. She does, in my opinion, if she doesn't show enough strongly here,
Yeah.
for that, just my opinion,
Yeah.
can you add, you're not sleeping well, right? Because you take, okay. Ye jiao tang. Ye is night, jiao is intersection. You asked me how do I do herbs, that's exactly how I do it. Meeting the night herb, ye jiao tang, fine, okay? And He Wan Pi. To unite with your happiness. That's literally what it says.
Yeah.
I didn't make it up. Just two herbs. I actually, personally, I would do it as a diffusion, as an infusion, rather than, because someone who has this kind of feeling, and you give them the herbs that you cook, and it tastes like, excuse me, horrible. It's like there were other. You have the interesting patients. One they rub their nose in, one they drink the nose in. It's like, why? It's like you have to make it somehow more pleasant. So if you just make it as an infusion and drink throughout the day, that might be a little bit easier. That's my thinking.
When you say infusion, you mean just steep it in hot water?
Steep it in, boil for maybe 10 minutes. But not more, not 30 minutes, don't cook it down for 30 minutes. Just do boiling water, maybe simmer 5-10 minutes or something like that. Maybe with some peppermint, with some boba or something. Thank you. All right, lunch. What, it's 12:15 now?
Yeah,